we've been taught to keep it a secret. It's something we're supposed to be ashamed of, something we're supposed to be embarrassed about. And there's no reason for us to be embarrassed, but it's not even our own shame or our own embarrassment. It's just been something that's been put on us because no one wants to talk about it out loud. And this is especially in the African American community. My mom's generation was told to keep a dime between her knees. That's how they told them about sexual health. My generation was told, don't bring a baby in this house. And then this generation, I think most of you guys are learning before your parents even have a chance to talk to you and have that talk. You're learning about your sexual health through TikTok and through Twitter and through Facebook. So what I want to do today is what WAPology in general is, I want to normalize the conversation. How can we prevent something if we're not willing to talk about it? How can we learn about our health if we're too embarrassed to ask about it? So it's time to release the shame, it's time to release the embarrassment, and let it all go and start having that conversation. So I'm gonna ask you guys some questions throughout this. I want you to be able to take that mindset and realize, just like you're able to ask your doctor about your headache, or your eyes, or your stomach, your vagina is a part of your body, and you should not feel ashamed to talk about it. We see these videos and these commercials on TV about male impotence, but they can talk about that all day, but we don't talk about the female issues. So there's no reason for us to be embarrassed about it. That's why I just want to make sure you guys are in the right mindset about it. So we're going to start by talking about our vajay, our vagina, our WAP. Every one of you, with the exception of, I saw three guys in here, every one of you have in your possession the most powerful, the most valuable, the most wanted, the most desired, but also the most stolen, misunderstood, misused, abused, degraded, and disrespected object on the planet. And I say it's powerful because, one, it brings forth life, but two, because almost everything men do in this world is to attain it, which means it has power. It has tremendous value, but in order to maintain its value, you need to first actually value it. And we're gonna do this by understanding it, by learning about it, by getting to know it, by loving it, by caring for it, and by protecting it. And if we treat it like it's valuable, then you're gonna start to see the value in it, and its value will start to benefit you. But if you treat it like it's no value, then it won't be. If you think about a diamond ring, it has value, it has threat that's gonna come to it. And if you have a diamond ring, you're gonna protect it. So I want you to think about your vagina in the same way and protecting it. So today we're gonna learn about addressing it, learning it and understanding it, but then we have to see what's coming for it. Like I said, anything that has value has a risk of threat. So if you ever think about, you guys know what Homeland Security is, or the CIA. They're put in place to know the threats before it gets to us. They intercept them before they get to us. So half the time we don't even know what threats were out there because they protect it. So I want you guys to be Homeland Security over your vaginas, knowing what threats can come your way and how you're gonna protect yourself. So you're gonna open your mind and you're gonna let go of shame, and you're gonna reclaim your power. If you haven't reclaimed your power already, you're gonna reclaim our power, like the power of the P. So I want you guys, ladies, to repeat after me. Say, I, your name, acknowledge the power I have within. I am strong. I am powerful. I am worthy. Today I am reclaiming my power. My power to create, to love, and to be respected without compromising my value. All right, let's go. So I'm gonna do some pre-questions. This isn't, oh, there we go. So this one is, can anyone tell me some parts of the vagina that you may know of? The clitoris, yep. Lips. The vulva, okay. The urethra, perfect. Anybody, I want one person can tell me about what is vaginal discharge. Go ahead. Okay. STDs, can anybody name a few for me? Syphilis, herpes, perfect. All right, so true or false? I want one person to answer this for me. Okay. True or false? Using a condom correctly will protect you from all STIs, STDs. Oh, false? Okay. All right. Now, we're going to go through all of that, and then we're going to get some more questions later on. All right, so I'm going to go quickly with the anatomy of the vajayjay. Hold on, let me grab something for you guys. And we're going to run through that really fast, just so we can get to some other stuff. All right, so the vulva, that is the outside of the vagina. I have this little tool, I got this little thing, I was so excited about it because I was able to start teaching people. And so I have this series on my TikTok called The Anatomy of the Vajay, the roadmap to the big O. But we're not going to do the roadmap to the big O. We're just going to focus on this part. So this is the vulva. This is the clitoral hood. This little pink item here is your clitoris. And then we have the vaginal canal. The vaginal canal is where, where there's sexual intercourse. It's where baby pass. This is where your period. All of that stuff is going to pass from here. And then right above that, you see that little hole? That's your urethral opening. That's where you're going to urinate from. And so this is pretty much, and then we have the labia, and you have the labia majora and the labia minora on the inside. And I want to show you another picture. All right, so with this picture, can anybody tell me which one of these are normal? Perfect. All of them. So with vaginas, I'm sorry, there's nothing to hold my little papers up on here. Put that here. All right, so you have some that have large clitorises, some that have small, some that have large labia majora, some have smaller. But we all have the same anatomy. It's just different, there we go, different shapes, sizes, and colors. Have you guys ever heard of the artist Pink? Y'all know how she got her name? So Pink was hanging around a bunch of black guys, and they had a bet, and I think she had to show them her vagina. And they were shocked because they had been around black women their whole life, and they were like, oh my God, it's Pink. And that is why she got her name. So when you think about vaginas, they come in all shapes, sizes, different colors. They don't always look like those pictures. Isn't that crazy? She said it in an interview, and it always stuck with me because I thought that was crazy. So my next question to you guys is, if I was to take a picture of all of your vaginas and put them on a screen, how many of you would be able to identify your vagina in a lineup? How many of you would not? And be honest. How many of you would not? Where your hands? Okay. These little mirrors. In the mirror. How many of you? I want you to go home and look in the mirror. It's the only way you're going to be able to understand and know what it's supposed to look like and know what's abnormal is if you know what is normal. Anybody else?
That way you can keep talking about my.
So I want y'all to go home, take that mirror, take a look at it, identify, love it. If you got a namer, name it. Know what parts of the vagina are there. Know what yours looks like. Everybody got them? On the back of those mirrors is my TikTok. The website hasn't been launched. It will be launched in April, but it's going to be everything WAPology. So it's on the back of those. So before I move on from anatomy, I want to give you guys a couple of fun facts about your vagina. I'm going to wait till she finishes passing them out. Let me see. I got 3 left.
Very popular. Okay. So where am I now?
You have a question? Hold on, somebody have the mic. Where do you go with the mic? Okay, why would you look at your vagina? I guess I'll hold it just in case somebody else has questions. We have to know our anatomy. Don't you know, if you saw your face, you know what your face looks like, right? You know what your nose looks like. You know what, if something, we don't have many Caucasian people in here, but I know one thing in medicine is people who have fair skin, they have to look at their body and make sure they don't have any new molds or new skin tags or anything like that, because you have to look for a risk of cancer. Anything on our body, we should know what we're looking at. We should know how to identify if something is wrong. If we don't know what it looks like, how are we gonna know if something's wrong? So if you have some irritation down there and you grab the mirror, because now you have irritation, you can't really tell if that's wrong or not because you never looked at it before. So that's why it's important to become familiar with your body, and especially your vagina. So you know what you're looking at, you know what's going on. So, a couple of fun facts. Your vagina, your clitoris. Your clitoris is the only human organ, the only one out of men, women, human organ that was created solely for pleasure. Did you guys know that? It has no other function, and it's the only one like it. So you have a pleasure organ. So like Cecily was talking about pleasure, you have a pleasure organ. A lot of times we look at sex and pleasure in the eyes of a man, but we don't realize that we're the only ones with one. And it has 8,000 nerve endings. That's twice the amount of nerve endings of a man's penis. So who is meant to enjoy sex more than us? That's what I'm saying. So I like to remind the young ladies that come into the clinic about this, because I want you guys to know that your vagina is for you. It's not just an object for young men and boys to go poke their penises in. It's not an item for exchange. It's not they give you love and affection and then you give them something to poke. Your vagina has many purposes, but none of them include payment for affection and love. So I want you guys to keep that in mind. And I'm going to talk about that a little bit more. But that leads me to talk about the purpose of the vagina. My little button not working. There we go. Yes? You might do better practice at the projector, maybe? Yeah, I tried that both ways, but let's see. Okay. Thank you. All right, so purposes of the vagina. Excretion and secretion. That is, and we're going to get on that, that's what I'm going to talk about most. But contraception and reproduction, that's going to be us making those babies and producing them, and pleasure. But I want to talk more about the secretion because that's going to allow us to know what is normal and what is not. Most of you guys have heard the term WAP from the song. Who sings the song? And Meg Thee Stallion. So if you're older and you don't know what it means wet, A-S-S, and then the P word. But I realized the song came out and everybody was talking about the song. All the guys were talking about they wanted a WAP. All the girls were talking about they had WAP. And I just felt like they were missing a piece of the conversation. And I know for a fact they were missing a piece of the conversation because in the urgent care, I would see 5 or more women a day with WAPs that weren't so good. So I felt like it's time to let everybody know, and that's why I created WAPology, because I wanted to let everyone know the difference between wet, and wet, because not all wet is good wet. You got some stinky wet, some dirty wet, some wet that's not right, some thick wet. And so in order for people, I just wanted to educate, and what I realized is the more I talked about it, the more I realized people didn't know. And it was a conversation that needed to be had. And it's a conversation that many people feel they're not comfortable with talking to with their doctors or their parents. And so that is where WAPology came from. So I just had to definitely tell you guys that whole point. We're going to talk about secretion. All right, so do discharge. What is it? Why is it there? And what can it tell you? So normal discharge. So somebody told me when I asked them the question, what is discharge? And they said it was cleansing. And that's exactly right. Discharge cleans dead cells, and it's also lubricating. So it's like protection for your vagina. It's just like your saliva in your mouth. So I always have people come into the clinic and they're like, I have this discharge. And it's completely normal discharge, but it's not normal for them. As soon as you hit puberty, that's when your body is going to start producing discharge. You should produce discharge every single day, whether it's a little bit, scan amount, or a lot. And what it's doing is it's removing those old skin cells, it's removing debris, and it's also lubricating the vagina to help protect it from anything. So just like in your mouth, if you get a cut or if it's dry, you're going to more likely get some type of abrasion. And so that's why we have discharge. Now, the consistency of your discharge is going to range from sticky to stretchy to creamy and cloudy. And that depends on where you are in your cycle. And the color is going to be clear, white, cloudy, or a light yellow. That's normal discharge. Our menstrual cycles. Ovulation. I'm only going to talk about that part of the menstrual cycle. Ovulation, the discharge is a thin, clear, stretchy. You know how like when you break open an egg and that clear part is like stretchy? That's how your discharge is when you are ovulating. And this is God's way of saying, okay, let's produce a baby, because it helps with transport. It facilitates movement. So if you were having intercourse and the guy's sperm will go, the discharge will help to facilitate the movement. During pregnancy, discharge gets to a thick, white, creamy sometimes. And then hormones like birth control, it changes a lot. Some people, when you don't have birth control, you would notice that your cycle, it brings you through different stages of discharge. You have sticky, you have thick, you have clear, stretchy. A lot of times with birth control, you'll constantly have a thick white discharge, and that's because it's fulfilling its purpose. It's being a protective barrier. So it's gonna cover your cervix area, and it's one part of the birth control's methodology where it's gonna actually be a protective barrier to block any sperm from impregnating you. And then the next time of discharge is arousal. So that's, again, depending on where you are in your cycle, but most of the time it's gonna be a clear to cloudy, clear, stretchy, and it helps to lubricate. That's the normal vagina. All right, so the normal healthy WAP. I like to talk about this because a lot of times people will have issues related to their pH. A normal WAP is going to have a pH of 3.5 to 4.5. It's normally acidic. So you don't want alkaline because alkaline is going to cause issues. It's self-cleaning. How many in here know, or how many in here have douched before? 'Cause- It's usually adults and older women because we weren't taught these things back in the day. But douching is incorrect. It's self-cleaning. So there's nothing that needs to go inside the vagina to clean it. It's gonna clean itself. So I always, when I try to get people to understand that, what I do is I kind of compare it to your nose. Are we in there digging in our nose, trying to clean our nose out? It's self-cleaning. It will clean on its own. All we need to do is use mild cleansers on the outside and warm water. Yes, ma'am.
Excuse me, doctor, can you actually explain or even describe what a douche product is? Because they might not know what that is.
So,
We know the terminology.
right.
I have no idea what that looked like.
So douche, look, I remember with my mom seeing these little bottles when I was younger under the cabinet, and they had these little nozzles in it. I used to play with the water and spray it. I didn't know what it was. It looked like something to play with. And so what they would do, it had a nozzle, and you you insert it and you squeeze it, and the water would go in. And I think it was like a vinegar water mix or something. But what it does is it throws off your pH. It's not, they did it to cleanse, but what they didn't realize was it was actually making things worse. So that's what douching is. Something I probably shouldn't have been playing with. So a healthy WAP has normal bacteria. Our entire body is covered with bacteria, and it's a healthy bacteria. And that healthy bacteria helps to fight off things that could cause us harm, like yeast or bad bacteria that we don't want in our body. And then a healthy WAP is going to thrive off of balance. So maintaining balance, you're going to maintain a healthy WAP. So things that it's very sensitive to is hormones and chronic illnesses. So people who have diabetes will sometimes have a lot of infections because it would throw off their pH. Medications, antibiotics will get rid of all your good bacteria and cause you to have infections. Improper hygiene, washing too much, washing with the wrong type of soap, washing internally when you shouldn't, those things will throw you off. Your menstrual period. The period blood is alkaline. So a lot of times people will say, I get a yeast infection or I get a BV after my period. And that's usually caused by maybe having a tampon, and that blood sitting there can kind of throw off your pH. Sweating, not changing your clothes immediately. I know you guys, when I was younger, I was told that if you wear too tight clothes, you get a yeast infection. And I thought it was crazy, but it actually makes sense. It's like that heat and holding that in and not allowing your vagina to breathe can change your pH. And sex, having sex with multiple partners, having sex with a new partner, or having sex with a partner who has multiple partners can cause you to have changes in your pH and cause STDs.
I have a question.
Can you explain, one of the things you talked about was washing internally when you should not. I think it might be helpful to explain what is considered internal versus external.
Yeah, I was supposed to show that with my little model. So, I have a video on my TikTok explaining this. When you wash, you're only supposed to wash, you can wash in between the lips, you can wash around the clitoris, you just do not go inside that vaginal canal. A lot of people are sticking towels deep in there, trying to go deep in there. On the outside only. On the outside only. And another thing is, this is always hard to tell black people because we love our washcloths. When you wash your vagina, it's best that you use clean hands because washcloths carry bacteria, whether it's clean or not. The cleanest thing on your body and the cleanest thing in the shower at that moment is going to be your clean hands. So washing with your hands would be your best bet. It's always hard to get people to accept that fact because they're like, I need my washcloth. How am I supposed to get over in here and get this and get that? But that's the best way to wash your vagina area is with your clean hands and not go inside the vaginal canal. Yes, ma'am?
You did mention tampons. What would you recommend, tampons or pads? Because I understood, but. in
So,
terms of-
yeah, tampons, okay, so it's one of those things where it's kind of a draw, but tampons, I'm not against tampons. I'm against, I think you should try to use organic tampons because a lot of them would throw things off with the type of materials and the chemicals that are used in there. I personally did not like pads growing up because I felt like it was sticking to me on the outside and I just thought it was gross. And personally, what I use now is a menstrual cup. Anybody else use menstrual cups?
Gang, gang.
Menstrual cups are, it's scary when you first see it. Cause like, I'm not doing that. But once you use them, I don't think you ever go back.
I would never go back. I would never go back.
You never go back after that. And at first you think it's gross because you insert a cup and it seals around your cervix and you're thinking, I gotta pull this out and pour this out, that is disgusting. But after a while you're thinking, what I was doing before was disgusting, that's gross. So the cup holds it in there, you're pretty much cleaner if you're using it properly. When you pull it out, you just pour it out. You're saving a whole lot of money, you're not buying tampons and pads, and it's really protecting you. You're not getting those infections because that alkaline blood is not sitting in there, causing you to have that change of your pH.
And you don't have to change it as often.
Yes, it fills up and you actually realize you don't bleed as much as you thought you did
Right.
when you get the cup because it fills up and you can change it maybe every 8 hours. Depends on your flow, but most people change it every 8 hours. You can go all day without changing it.
And where can you purchase this?
You can get them online. They sell them in the stores now. When I was first buying them, I think I bought it from Europe, but they have them in Target. I think the Honey Pot sells them now. Yes, ma'am. If it's a natural, organic, healthy spray, it's okay. But why would you want a douche?
Well, as an older person, that's something that, we were taught to do, a few times a year or whatever. So I just wondered if I heard.
There's no need for it. I think I always ask the question why, because a lot of times we do things based on tradition and things that our parents may have taught us, and we don't know the reason why. And the reason they did it was because somebody told them to do it, and there's no purpose in it. Douching is not doing anything for you. If we have proper hygiene, then we won't need to. We won't need the sprays, we won't need the extra douching because we're properly cleaning the way we're supposed to. Hold on one second.
I don't know if y'all be on it, I know a question, but the question is like cleaning your vagina with like just water, or do we need soap?
So most will tell you, most people who are really who have studied the vagina will tell you you don't need anything but warm water. I mean, most of us, we want some type of something to make us feel better. Have you guys heard of the Honey Pot? Okay, so I started using that probably about 6 or 7 years ago, and that is an all-natural cleanser, something that you can use that is very light, that you really don't, it's all organic, and so you can use those type of products that's gonna help you or if you can't get that, you could use like a Dove, but I wouldn't use anything. I almost cringe when people tell me they use Dial in their vagina area. That's too harsh. You didn't knock every bit of your normal flora out, and you're trying to wonder why you keep getting yeast infections because you knocked it all out.
See, Dial has been advertised for sensitive skin, and all my kids have sensitive skin, and that's all I buy.
And it's
So
great.
you don't buy Dial anymore?
It's great. Oh, Dial it's okay for your skin.
Just not your vagina.
Just not your vagina.
Okay.
Not your vagina. Yes.
What are some things we can do to help bring our pH back to baseline?
So I'm gonna get to that. Give me a second. You had a question too?
What about those like vaginal steams when you sit on a pot?
It's not needed. Go ahead.
I know that there are some lubricants that are flavored. Are those safe to use, or is that?
I would read the ingredients on it and make sure that it's nothing that you really cannot pronounce or find the name of, because some of those things will cause you to have, some irritation.
How do you feel about summer season?
I hate it. It's just too much. It's one of those old school products I'm just not a fan of. Anybody else over here?
What's the sign to know that basically your pH is all?
Okay. hold on, we're gonna go to that. When it comes to cups, yeah, the cups, they work just fine, yep.
I have one more question. I know a lot of women, I was gonna use baby powder on vajayjay. That's popular.
Back in the day,
Yeah.
they put that powder up here, down there. And that's why so many people are dying of ovarian cancer. So stay away.
Baby powder.
I know, I had aunts where you just saw you weren't clean unless you came out of there with some powder on your chest, so. Stay away from the powder. So, I want to talk about keeping a natural, healthy pH. I think my next slide talks about STDs, but I think before I get to that, I'll tell you guys. If you have your phone, pull out TikTok and follow Dr. Keneitra. I have a million of these videos where I talk about them. But when it comes to pH, maintaining a healthy pH, when your pH gets thrown off, there's so many ways to bring it back to normal. So maintaining it and having a healthy pH, you can maintain it by just washing correctly, not washing with harsh soaps, with washing with mild cleansers, not using any type of sprays or anything that you haven't read the ingredients on. Most of the natural stuff that's coming out lately, people are pretty informed when they're creating them. Some of the ones that we had back in the day, like Summer's Eve, which I'm not a fan of, it didn't take into account all the things that we know now as far as our flora and our pH. And so your question was, how do we bring it back to, so let's say you notice that your pH is off for some reason, maybe you're getting an odor or you're getting irritation. It depends on why your pH is off, and so that's gonna determine how you treat it. So I'm gonna go over the reasons why you would have a change first, and then we'll talk about the treatments for those. So like I said, changes in discharge will be caused by illnesses, hormone change, pregnancy, your menstrual cycle, and vaginitis. Vaginitis can come from irritation from like dermatitis or sensitivity, but it can also come from the disruption of your natural flora. So that can come from sweating, like I said, or taking antibiotics or anything that throws off your normal bacteria. And then it can come from your STIs and STDs. So unhealthy why? Yeast infection. How many in here has had a yeast infection? Most women have had a yeast infection. And so yeast infection, the causes of it are getting rid of that normal healthy bacteria will allow yeast to grow. So I always tell my patients who are begging for antibiotics for a cold, one, you don't need antibiotics for a cold, but two, you're getting rid of all your natural bacteria. And so you take some amoxicillin for a sinus infection and then all of a sudden you're itching. That's because you've gotten rid of the good bacteria that usually fights the yeast, and so now that yeast is going to grow. The discharge for yeast infection is usually going to be a thick, white cottage cheese discharge. Has no color, just white, and usually does not have an odor at all, and it's caused irritation. So I have a lot of times people will come in and have a milky discharge and they're itching and say, I got a yeast infection. No, that's not a yeast infection. Yeast infection is going to be cottage cheese, thick, white discharge with no odor. Bacterial vaginosis. Bacterial vaginosis is our most common vaginitis, and it can be very embarrassing, and a lot of people suffer with it and can't figure out why they can't get rid of it. It has nothing to, well, I'm not going to say it has nothing. It has nothing to do with hygiene in the sense that some people think it does. So you have all these men saying, oh, she smells fishy, or this is going on. That doesn't mean she's dirty or nasty. She could be going home taking a shower 3 times a day trying to get rid of this fishy odor, not realizing taking that shower 3 times a day is making it worse. Because you're now throwing off your normal bacteria flora. So with bacterial vaginosis, your causes are anything that's going to change your pH. That can mean sex with a new partner. I have a lot of adults that come in, they get a new partner, and they're not using protection, they'll get a BV. If they have multiple partners, that's how a lot of times I know when someone is having sex with multiple partners, if they're coming into the clinic all the time with BVs, and then they'll ask questions, and that'll lead me to know that they have multiple partners. If your partner has multiple partners, So a lot of times people know that their significant other's cheating because they keep getting the BV and they're doing everything right, but they keep getting this infection because their partner is having other intercourse with other people unprotected. There's more causes, we'll go through them. Vaginal irritation, sometimes it's irritating, most of the time not, but it will cause some rawness, and it will have a gray, maybe white, maybe yellow discharge, and it has a very, very foul, like fishy odor. So if you ever notice a fishy odor, then that's bacterial vaginosis. A normal vagina has a normal light odor. It's not anything offensive, it's just a vaginal smell. But bacterial vaginosis, you're gonna know when it's a bacterial vaginosis. And then our most common ones are, bacteria and yeast. You can have bacteria and yeast at the same time. So if you have itchy, but it's great discharge and it's foul, you can have both at the same time. I've seen people with both. All right, chlamydia and gonorrhea, those are our most common STDs. And those will give you get that with unprotected sex. I have to mention this, ladies, the only way you're gonna get chlamydia gonorrhea is unprotected sex. Don't let a man tell you that he got it from sitting on a toilet seat. It's impossible. But y'all laughing, but it's true. I've had patients call me, I have people in my email inbox saying, well, he said he was sat on the toilet and he got it. It's untrue. The only way you're gonna get it is unprotected sex. Abnormal discharge and odor. So it can cause you to have a yellow to white abnormal discharge. It have a foul odor, and it also causes burning with urination. It can cause pelvic discomfort and complications and long-term risks. If you don't treat it, you can get something called pelvic inflammatory disease. Has anybody ever heard of that? She's looking in the mirror in her eyes. I caught you. So pelvic inflammatory disease can cause you to be hospitalized. So sometimes people get chlamydia and gonorrhea and they don't know they have it. And they get to the point where they now have pelvic inflammatory disease and have to get hospitalized with IV antibiotics. That can cause infertility. So chlamydia is not, it can be a serious, people are like, oh, it's just I can treat it with antibiotics, but if you don't know you have it, that can lead you to have difficulty having children when you get older.
Can I just say real quick, and actually with chlamydia and gonorrhea, those are some of the symptoms, but actually the studies are showing that in a majority of cases, you actually do not have symptoms at all.
None at all.
None at all. So that's why actually it's important to get screened because
Yes.
it tends to be actually that for people with vaginas in particular, they are less likely to show symptoms.
She's absolutely right.
Now, the dicks are probably burning, but
Most of the time, women will find out that they have chlamydia, gonorrhea, either because their partner told them something or they went in for their yearly exam. That's when most of them will have them. Those are the symptoms that if you have them, that's what you would have. But most people, and that's why I wanted to make it known with pelvic inflammatory disease that you can get something as serious as that because you don't know that you've picked up something. So, chronic issues with unhealthy WAPs. Can anybody tell me any chronic STDs that cannot be cured? Besides HIV, something that's going to affect your vagina or you can see it. Herpes, yes. Herpes simplex. So, it's more common than you know. So y'all remember where everybody was talking about Usher had HSV? Y'all remember that? So Usher's my husband. I don't know if y'all know, but we're married. And so we're married, and I had to tell my friends off on Facebook because I was like, y'all talking about him, but most of y'all think, I'm trying to figure out why you keep getting that razor bump in the same spot. Because that's herpes. And you think, because herpes is huge. 50 million people in the US have herpes, and 80% don't know they have it. I've had patients come in and say, I got this razor bump, and it keeps coming, because it's not a razor bump. It's herpes. So it's very, very common, and people don't realize how common it is. It's also very misunderstood. Herpes is one of the most difficult conditions for me to explain to patients, because you could come in with your husband, you can test positive for herpes, y'all been married for 5 years, you've never had sex with anybody, now you say he's been cheating on you. We don't know. You could have had herpes 5 years ago before you met him, and you could have gave it to him. You just didn't know you had it. You weren't tested for it. You don't know you had it. It's one of those things where you're not going to always have symptoms. You're not going to always have an outbreak. You may have an outbreak and didn't know it was herpes, and so you'll never know who gave it to who unless you've been getting tested for it regularly.
You can have it that long?
You can have it for that long, and you can spread it whatever showing.
Wow.
Yes, ma'am.
When you get like a yearly screening for STD tests, is herpes not included in that?
Herpes a lot of times are not included in your yearly test. You have to ask for it. A lot of people won't test for it because people will be asymptomatic, and it brings more trouble trying to know, I guess, knowing about it, so they won't do it. I always ask patients, do you want me to screen you for herpes as well? But it's very confusing. It's one of those that a lot of people try to avoid. There's two types, that's HSV1 and 2. And I'll give you a story. I worked at the Navy base, and I had a patient that came in, and he showed me a bump, and I said, that's herpes. He went home. He was ready to beat his wife, and she came back. She was crying, and she was like, I didn't do it. And they both in there like screaming at each other in the office, going crazy, screaming. I finally get the test back. His bump that he had below the belt was HSV1. HSV1 is usually causing cold sores. HSV2 is genital. HSV1 can be oral or it can be genital. When I gave them the results, I said, have you ever had a cold sore? And she's like, yes. She gave him HSV1 down there by giving him oral sex. So HSV1 can be spread both orally and genitally. HSV2 is genital only. If you have HSV1 and you've had a cold sore as a child, that's probably HSV1. If you were to get HSV1 below the belt, it's most likely that you'll have one outbreak and none again. HSV2, you can have outbreaks every month, you can have them once a year, you can have them never ever. It just really depends on you as a person. The symptoms, you have like genitally, they're clusters and they're painful, and it can last from like anywhere from 5 to 10 days. Orally, there's just like a little lesion on your mouth on one side. Outbreaks, like I said, outbreaks can vary. You can spread it. That's why I asked the condom question. You can catch HSV with using a condom or not because it comes from viral shedding. So if that person has it on their skin and they shed it, so that is one of the infections that you can actually get without having intercourse. You're just doing a little rubbing against each other and you shed the virus, you can get HSV1 or 2. HPV, that's your little quiet infection. This is why you get pap smears. This is where we're testing the cervix to see if you have cervical cancer or if you have HPV, because HPV can cause cancer. It can cause, most strands are asymptomatic. So most people will not know they have HPV. That's why we do screenings. That's why you go get pap smears. So we can test to see if you have it. Most of them are transient, where they'll come and go, and most of them will go away. The ones that don't go away, they can cause you to have cancer. That's throat cancer, rectal cancer, or vaginal cancer. Some also cause warts. So those are your chronic unhealthy ones. Just from my experience, when it comes to protection, I think this generation, the current generation of young ladies that are in high school, they have something that my age group didn't have to deal with. Generation porn. It's the one where you are expected to do something or the male expectations of you are different than what they were expected at our age, because you have boys that are watching porn. And so you have a lot of times where they have this expectation of something they've seen on porn, and they don't want to use condoms, and they don't want to use those things. So I think that affects how we protect ourselves. Pleasure over principle. They're going to tell you that it feels better without the condom. And if you've ever had sex before and you didn't use a condom, you kind of probably agree with them. And then my experience in the urgent care, I realized that most women aren't using protection. Most women aren't requiring protection. And that's why I talked about, and I was right on with Cecily when she talked about your pleasure. And when you think about sex as something that you're just giving in exchange for a relationship, you're not going to worry, you're not going to have these standards, and you're not going to have these requirements. But when you look at sex as a part of you, and you have the right to say what you want to say, and you have the right to require protection, and not worry about whether he's going to stay there or not, because penises come a dime a dozen. They got a bunch of them. They're not going anywhere. Like, you can get another one. And it's like, so you can wait on it if you're not ready to have sex. At this point, when it comes to sex, it should be a choice that you're making based on whether or not you're ready for it, not based on whether or not you want to make him happy, because it should be about your own body. And that's why I love when she talked about pleasure. And that's why I made a point to tell you guys that we have the only pleasure organ. So you can go buy one if you want to. You don't have to have this guy. And if he doesn't want to use protection, that should be your no at this point, because you don't know. And if you think about the world, and if you think about your high school, there's likely more ladies than there are guys. And the reason why I see more women coming in getting tested for these infections and less guys is because that one guy is spreading it to all of these different women. So you got to think about that. Yes, ma'am.
Can you talk a little bit more about protecting the WAP when you are not having sex with men, when you're having sex with people that may be women or different gender identities?
So that's when it comes to having an understanding of your vagina, because it's not always cut and clear with intercourse, with heterosexual intercourse. You have to know how to maintain that health, maintain the natural healthy discharge, know what's natural, know what's healthy, know when something is off. And protecting it is gonna be knowing, okay, I'm not gonna allow something to come into my space if I don't understand it, if I don't know it. That includes sexual toys. You need to make sure that's clean. I don't know where that came from. That includes, I have a video where I talk about how men can cause bacterial vaginosis because they're sticking their little dirty fingers. Like, go somewhere with that. There's so many ways to protect your WAP, and you have to look at everything that's coming in contact with it. When it comes to oral sex, when it comes to all of those things, like you haven't been to the dentist, you're not gonna put your mouth there, that's just nasty. So you just gotta think about all of those different things when it comes to protecting it, that it is very sensitive. Like I listed things that it's sensitive to. It's sensitive to the simplest things that are not sexual. So yeah, it's sex in it, now it's like a whole nother game. I think somebody asked me a question about, who asked a question about pH again? What was your question?
How do you return the pH in the vagina to baseline?
So, repeat that question, please. How do you return the pH to baseline? So you can do things like, I'm a naturalist. I don't like taking medications. So bacterial vaginosis, the way you would treat it is you would take a medication called Flagyl. Flagyl is this chalky pill. It's disgusting. It's nasty. Nobody wants to take it. So if I ever notice that I have a discharge or something is off, I would go and soak in some apple cider vinegar. I'll go and do all kind of natural things. But you can also use a pH balance wash that can help you. So I would do something like the honey pot, or because of TikTok, I created my own. I'm gonna give you a sample. So what I realized was a lot of people were getting BV and they were doing everything they were supposed to. And they were still getting it. And it was because their partner, they could be married, but their partner was using Axe body wash. And so I was on there TikTok making money for V Cleanse, I think the name of the wash was, and Honey Pot. They were getting all of these views because of my following. So I was like, hey, y'all need to create something that's for men and women. And instead of waiting for it, I just created my own. So it's all natural, and I'm gonna give you this. So I want to ask you guys, what are the boundaries, or what do you feel may be causing you difficulty in protecting your vagina? What have you experienced? And I want to hear from young people and older people, because I think the younger generation has different challenges than I may have had. Go ahead.
Mine saying that it's less pleasurable to wear a condom and that they can't
Exactly.
get to their O.
So how do you feel? How do you get over that?
Me personally, I'm really confrontational, so I'll be like, really? You've never used one successfully? And, but other times, I mean, it's hard.
Yeah.
It's hard to combat that, especially you're in the flow of them, you're going through the motions, and then you have this like kind of like block in the road and almost a disagreement that shouldn't even be a disagreement in the first place.
Do you ever feel pressured because like you feel like, okay, he's not gonna like me or he's gonna leave?
For sure.
And if he leaves, what happens? He's gone.
Yeah.
I mean, did it hurt you?
No.
Yeah, that's the thing. I think even as an adult, we look at things like, oh, well, he's not gonna like me, or he's not gonna call, or he's gonna get upset. Okay, and
Cool.
I mean, like I said, there's like penises come a dime a dozen, like they got more. So you don't have to worry about that. Yes, ma'am. I think it does. I think it's something you start to realize as you get older that it doesn't matter. Like the ones that don't want to respect your boundaries, there's 100 that will. So you don't need that in your life. And if they're not respecting your boundaries, then they don't respect you. And so you have to have that self-respect to say, I'm going to require someone else to respect me as well.
Can you repeat your comments? Because we can't hear that.
Oh, I'm sorry.
Can't
The
hear
mic.
Their question.
Where did the mic go?
They can hear you answer, but they can't hear their answer.
She was talking about, I'm going to give you the mic so you can repeat it.
Okay. I was just saying how often men will say that when they don't, like, when they're about to have sex, that they can't achieve an orgasm with a condom on, or that it's less pleasurable for them, and that how that's just like kind of a block in the road for when you're going through the motions and something you have to confront. It's not easy to confront.
Also just say that, like, I think part of the issue and even like presenting that is like the assumption that like a person with a penis has to have an orgasm solely from penetrating your vagina, and that is not true. Sex can look a lot of different ways. I think you should look to your gay friends for innovation in that area, because sex is not always penis in a vagina, and so I also think that that is an issue that is coming up in terms of, but like, that doesn't mean that we can't have sex, that just means we might have to have a different kind of sex. And I think that it's not always an issue of just like dismissing the whole partner. Sometimes what that can do is actually open up a conversation for actually how to have a more expansive sexual experience. Like maybe that's when you're introducing some toys. Maybe that's when you're introducing some hands. Maybe that's when you're introducing like different ways of being intimate with people.
Do you have a question?
No, I don't have a question. I don't need the mic. Can y'all hear me? I was gonna offer that I was very, very grown when I started having sex, and not telling y'all to not have sex, but they're gonna do whatever you want to do. If they wanna do it, whatever your rules are, they're gonna go with them. And part of that comes from not giving it right away, so that by the time they do get it, they're willing to use the condom or use the this or do it here or.
It's understanding your power.
Yeah.
That's why I talked about the power.
Once you know that you are the prize, like how she talked about, it's not as pleasurable for them. This is about pleasing me.
Exactly.
Who said we was trying to please? This was about you. You know, once they understand that, and once you don't give it up right away, and then you got them to where they really want it, they're gonna do it however you want to do it.
Exactly.
So just like she said, hold on to the fact that you are the prize, and then you won't have to worry about going through the rest of that. Because boy, girl, whatever, however you're gonna have sex, whatever your orientation is or whatever you're attracted to, it's gonna be on your own terms. Once you're comfortable knowing that you have that power and y'all both have that respect for each other, it'll be a give and take, a natural give and take.
Yes, ma'am.
So my comment may be layering.
My comment may be layering on a level of conversation that we really don't have time for. But what you're speaking to as well, I think is important for especially our young people to understand that that's a form of abuse as well, emotional abuse, making demands that you don't want, that you don't believe are respectful of your person, your pleasures, it's a form of abuse. And I think too often we equate abuse in a relationship to physical. If I'm not being beaten, I'm not being abused. But I would submit, and I mean, you can speak back to it, that actually that too is a form of abuse. It's emotional, it's spiritual, and it's violative. Do you have any thoughts on that?
No, I agree with that. I agree. I mean, a lot of times we get pressured and we get into this people-pleasing thought process where we have to please all the time, whether it's comfortable to us or not, and it can be abusive, and they will use it to their favor to make sure they get what they want when you're not getting what you want. And that again brings us back to the power and understanding our power and understanding our value and knowing that we have the power. It's what they're looking for, something that we have. We contain it. And we have the choice to say whether or not we want to give it to them or not. And we don't always have to just hand it over. So, I think we're running out of time, but any other questions? One more question? Yes, ma'am.
Can certain type of condoms throw off your pH?
Yes. Yes. So a lot of times people have irritation from condoms. I know people that say they get yeast infections from condoms. It's the chemical barrier on that can cause you to throw off your pH. I always recommend that you, one, urinate after sex because that's going to help you prevent you from getting UTIs. But two, you need to wash after sex to make sure you kind of bring back and maintain your healthy pH and using something that's a nice healthy wash. I'm going to give you one before you leave.
Because you mentioned, I wasn't going to ask you, but you mentioned a UTI. Why does the vajay burn so much when you have a UTI?
Because of its location. So on here it looks like it's high, but it's like right in that entrance. And so that's going to cause that burning. And so with any irritation, that tissue gets inflamed and you have inflammation there. And so it's going to cause the burning. And then the urine is also going to just cause it itself to burn.
I've heard on my TikTok or whatever that sperm can throw off your pH balance. Is that true?
What can throw off your pH?
Sperm?
Sperm, yes. So ejaculatory fluids are alkaline. And so if you're having intercourse and he ejaculates inside your vagina, and if you leave it there and just, it can actually cause, it can throw off your pH as well, yes.
I would like to get a little sample of that because my pH is thrown off the line. And I've been wanting to know how to, have
Okay.
that. Yes, I am married for 2 years, but I didn't have pH.
Yeah.
She's not sure they say it. Give it to all the
Yes, ma'am.
Kind of similar to the question about Keneitra Brown. Like different lubrications that people buy. There are certain ones to stray away from. You're supposed to stick to water-based.
Water-based, that's gonna be your best ones. Stay away from trying to put food down there. I know sometimes like people wanna get romantic and go put stuff, just no. No whipped cream. I would stay away from anything that's like food related in that area. Yes, ma'am.
What do you feel like would be the best treatment for yeast infections, like from a natural?
So you have your medical treatment, which is like diflucan, but you can also use natural organic things that are antifungal. So I do things like coconut oil and a couple of drops of tea tree oil and things like that on a tampon. TikTok, it goes into it. Yes, ma'am.
I have a friend that told me she got kind of like chronic yeast infections and her gynecologist recommended using just like the antifungal cream for your feet. Like
It's kind of difficult because that may cause some irritation on the inner areas of it.